Okay, so I think we'll start now and see how we do as other people join. My name is Paul Target, and I'd just like to welcome everybody to this Bath Digital Festival discussion on digital transformation, health and social care. We're joined today by a panel of people who are involved in the delivery of health and social care from right with voluntary organisations through to national organisations. What I'm going to do in terms of the format today is I'm going to quickly introduce everybody. We're then going to have presentations from four of the panel, and then we're going to get into a discussion. For those of you who are attending, the way to ask questions in this session is to actually use the Q&A function and to raise questions through there. And then once we've got to the end of the different presentations, I will then kind of feed those questions back to the panel.
Is Paul frozen for other people? Okay, it's a great start. I think what we'll do is, while Paul gets back in, should we go around and just introduce ourselves before we then sort of go into the presentations? So I'll start and I'll talk around who's on my screen and let them introduce themselves. So I'm Jo Scammell. I'm the head of commissioning and wellbeing at Virgin Care. We provide the community services across Bath and North East Somerset. And I'm going to hand over to Janine.
Thanks, Jo. My name's Janine Woodward-Grant. I'm the Deputy Chief Executive and the Digital Lead at the Carer Centre here in Bath and North East Somerset.
Thanks, Janine. Lorraine?
Thank you. I'm Lorraine Foley. I'm Chief Executive of the Professional Record Standards Body. We're an independent community interest company, and our core purpose is developing the content of information records nationally.
Thanks, Lorraine. Shan?
Hi everyone, I'm Dr. Shan Mantri. I'm a GP by training, but I work in digital health as well as management. So I am what's called a Chief Clinical Information Officer for our local CCG in Bath, Swindon and Wiltshire, which simply means it's the clinician that leads on information and data. I also do work for the regional team and something called a West of England Academic Health Science Network, as well as a number of providers of digital healthcare solutions.
Thanks, Shan. And James?
I am James Carlin from 3SG. We're the third sector infrastructure organisation for charities and social enterprises in Bath and North East Somerset. And our mission is to give a voice to and support all of those kind of organisations.
Thanks. And I can see we've got Paul. Back over to you, Paul. We've just introduced ourselves.
No, that's really good. Yeah, my Zoom app completely crashed. Hi. So funny. So I'm Paul Target. I'm the Managing Director of Ribbon Digital Care. We're based in Bath and provide services to health and more recently social care organisations. And I think what we've done today is try to bring together a group of panellists who you've just heard from, say, Janine working with carers and other third sector organisations, with James through to Jo, who's commissioning services with the third sector and also managing delivery of wellbeing and adult services in Bath, through to Shan at the CCG level, who has obviously involved in quite a broad health and social care agenda, and then Lorraine, who is nationally working across all sorts of different projects with the Royal Colleges and NHS Digital and other social care organisations to actually make information work. So I'm really excited about the panel today and the kind of discussion we're going to have. So I think without a delay, I think what we are going to do is have Jo now provide us with a short update on what Virgin Care have been doing.
Thanks, Paul. I'll ask you to stay off mute for a second, Paul, until I get my Zoom, just to check that you can see everything.
Okay.
So you should be able to see my screen and hopefully my PowerPoint. Can you see that?
Yeah, no problem.
Okay, so thanks for the introduction, Paul, and for inviting us onto the panel today. I know a couple of our panellists well and others less so, so I look forward to the conversation afterwards. I've spoken a little bit about my role, my substantive role for Virgin Care, which is a really exciting one, to work with a lot of the third sector organisations and also to directly manage the wellbeing services across the area. So do lots of work in partnerships, and in COVID I've had the privilege for my role to be changed slightly to deliver what we've called at the moment the Compassionate Community Hub, and I'm going to use that to tell you a bit around the digital transformation in healthcare today. I think it's fair to say technology has been a significant part of the COVID response, and I heard a Radio 4 podcast that talked about sudden shocks needed in systems to invoke change, and haven't we had one of those in the past couple of months? I think whilst COVID, has and continues to present one of the biggest challenges in a generation for us in the realm of health and social care, it has also enabled one of the biggest steps forward in digitisation since the health service began, really. And I was thinking about the role and the word digitisation. I'm sure that I'm not a technologist, and some of your panellists can correct me on this afterwards. But for me, the difference is that before COVID, we had digital responses to services, and those were, we called them technology enablers, and we had IT departments and transformation departments that had lots of tools in boxes, but they weren't necessarily used to change the way that we work. And I think across health and social care, the sudden shock, if you like, in the COVID response has meant that for the first time we are digitising services. So we are using them to change the way we work, not here's a piece of technology that you can stick onto the end of a service and that's another set and a repertoire of something you could use. It's become the thing that you have to use, and you have to use it to change the way you work. And I think it'd be a good thing to pick up in the questions at the end, as I'm sure different people will have different perspectives on that. And digitisation in our local health and care services across Bath and North East Somerset has taken many forms, from widening, the offer of off-the-shelf toolkits around virtual consultations, the Teams app that we all had before, but it's now become sort of a bit like the red dot on the BlackBerry. You hear it in your head when you go to sleep at night, right through to bespoke solutions. And we've been working with Rivium to deliver one of those, which I'll touch on. So those are bespoke solutions adapted for specific areas, and the transformation has been huge and is ongoing. Today, I'm just going to show you in a second a short video about a specific piece of work we've undertaken, enabled by digital transformation, as well as people in the delivery of a COVID response hub. So we in Virgin Care have worked with 3SG and third sector partners, and James is on the panel today, Baines Council and Baines CCG, together with organisations like Rivium, and we've come together to deliver a service that supports our local residents. And I thought the best thing to do would be for you to hear that from the people themselves. So I'm going to switch now to a YouTube video, and we've tested this, so it should work, but it's just a 2-minute video.
I think at the point of lockdown, for many of our clients, it was a very scary time.
It was quite a lot of unknowns.
And asking all of our colleagues to do something quite different than they've done in their day-to-day lives.
We've got this legacy and network of people that want to help each other.
Something that we've been aiming for many years, which is that no wrong door approach.
We genuinely got a structure now that is enabling us to work with people at multiple levels in real time, simultaneously.
I think that's been hugely beneficial to Baines, but also to the organisations that make up the Compassionate Community Hub.
Right, I'm going to come back to you before it plays another random YouTube video. We'll all be in trouble. So I hope that was just, have got a longer version of that, but what I wanted to give everybody was a brief snapshot of what we've done to work together. And we set the service up from scratch with all those other organisations. Today, we've received over 8,300 calls, a bit of an update to this slide that I've put in. And you can see some of the impact calls here. So over 1,500 volunteering tasks, which I know James will say has gone up since then, and over 5,000 children's meals delivered. The way that this works is to try and create a sustainable response for people who are often vulnerable people in our society. And of course, COVID's sort of developed a new vulnerable definition as well. We relied a lot on the power of people, organisations, willingness to respond, to work in a different way. But actually, it wouldn't have been effective without technology. And at this point, I also have to say it wouldn't have been effective without the integration of, social care and health clinicians and professionals where we are co-located. So there's a real safety angle around the service that was created here, around having, intervention, safeguarding support, and really integrating with those care coordination services. But James, Paul, myself, and a few others got together to work out how we could possibly make this work. So we have a triage team, and then we have a pod response. And we had no way previously of securely exchanging information within our own organisations, let alone outside them. Sometimes it was challenging. We have the NHS security, which is absolutely right. And that's where we started to develop with the Rivium team, the referral management solution. We had already been rolling that out in care coordination, so we knew it was secure and compliant and had a data privacy impact assessment. But we also wanted to use something that we could possibly take forward, and it's had really great effect. So I'm going to show you just an example. So now, for example, when a referral is called into triage, somebody's calling for support, one of those 8,000 people, and they go through an online triage form with our teams, and if they need, they're either signposted to further support, signposted and supported through to clinical services, or they determine that they need a response from a response pod. And we've got about 12 response pods now, those being things like housing, citizens advice, money matters, well-being, about physical well-being and health. We've got a family pod, a food and support pod, and then people that support volunteers from 3SG, and also logistics, so we can get somebody out an emergency food parcel. So an example of that might be that somebody calls in with no food and no money, and they would go on and go to the the triage team would determine there was a genuine need for an urgent response. The logistics team would deliver an emergency food parcel. They then pass that on to our food team, who would work with the family to create a sustainable solution, and then get involved citizens advice if that were appropriate, and then possibly the family would receive an ongoing call from Bath Mind if there were any mental health needs. So before, the family might have had to call 3, 4, 5 or 6 different people to get that response. And now they call one place and they receive the same joined up level of care, and a care which is, for the first time, I think, wrapped around the service user rather than the service user going the other way around. The digital enabler of that is obviously significant, and you can see here that what we've got in the referral solution that we've got from Rivium is around the number of referrals. So we can see each day how many referrals are coming in. We can plan for our workforce to be flexible. And for the first time, again, you can see somebody's journey through the system. So you'll be able to see from some of the slides I'm showing in the background, somebody who went through different pods, if you like, the stories through housing, through to wellbeing, included some weight management support, and then got the relevant help and had a successful outcome. And below that, you can also store information about the individual's referral. So it's not their innermost thoughts, and it doesn't replace the clinical system, but it joins up that referral and allows us to securely transfer the person's care between different organisations appropriately, securely, and effectively. And in a time where we have to work remotely, this enables us to work not just from a physical hub, but actually across the BAME system. This has had such powerful impact. I think we're now working with the council and Bath University to do some analysis and impact on what effect this has had. Certainly, we know that at least 500 calls in the first month would have gone to need a professional response and have been instead diverted to the system. We know that the feedback from primary care, from social care, has been positive about how it supported residents. And we know from the residents themselves that the impact has been significant, and that the vast majority of people that go through that service report a dramatic increase in outcomes. So we want to keep that and sustain that. And that's one of the pieces of joining up the referral about the individual. So the next one is around the integrated care records. I'm conscious we could speak about all of these for the whole day. So the integrated care record, also a piece of technology. It's been involved for longer. It's a product which is available nationally that we've customised and worked with to deliver in Bath and North East Somerset. Some of the panellists will agree it's been a long time in the pipeline for Bath and North East Somerset. It means that you are able to see coded and structured information about an individual and share that with appropriate registered professionals across the system. So that means we've got information from the GP records, all GPs in BAMES, System 1 community data, social care data coming from Liquid Logic, and Millennium RUH data all together in a single view. We are also expecting the AWP mental health data in imminently in the next few months. So the integrated care record has massive benefits for people receiving care, because for the first time we can see live information about the individual on appropriate use. We can also then take that data and use that to look at some risk stratification. So I've just presented a slide here, which is a snapshot from one of the test systems, which just shows you the type of data people launch into from their normal clinical systems. They launch in securely, and they can see the information from health, social care, GPs, as we said, in a structured format. So, for example, we can see if somebody's in hospital. One of our mental health teams found that someone who was being looked for by GP in a number of different organisations was actually in hospital. So you could take a look and see. Another example that I've got from, in the context of the hub and the community hub that we spoke about, that means that somebody that called the other day called up for smoking cessation advice, and this gentleman was very talkative and was increasingly incoherent. Our staff member brought that to our multidisciplinary team meeting and expressed her concern about the individual. We thought that they were probably very well known to mental health services, but we just looked on the integrated care record to make sure and find out who their GP was so we could get in contact with them. Actually, what we found was that they had a very old diagnosis but hadn't been seeing their GP for anything other than smoking cessation advice for the past 4 years at least. So this indicated to us that actually, and having spoken to AWP, he wasn't known to those services and he wasn't receiving the care that he probably should be. And we were able to speak to his GP and make an appropriate referral to the services for support for that individual who is clearly in need. So we are able to link this into providing, the most appropriate care for an individual, obviously based on professional need. And sometimes it's not about the care that you can provide, but the care that you wouldn't if you hadn't have had the information. And we've got countless examples of those. So we've now finished the technical delivery, and we're looking at population health. So I said there are 3 parts. The second part is around direct care, around risk stratification. And that is around using the information we have about people to try and understand who may be in need of our services, or who should be coming forward that we haven't seen from for a while, and where are this problem with COVID, where are these hidden need of people that actually aren't turning up at their GP surgeries anymore, and how can we help? So the combination of all of that incredibly rich information and data set that we've got from the integrated care allows us to start undertaking some of that analysis and working together across the system with the council, with the hospital, and with our GPs. So we can take it to that level. And then the final level is around using this information. We haven't started yet around anonymous data to try and really think about how do we commission services? How do we know what services need to go where in the population? So there's some really exciting parts coming up to that project. And you can see there are things like COVID alerts. I've put in a graph there which shows how many times do people start looking to see, is the person I'm going to go and see today in district nursing COVID positive? Have they had a COVID test, and are they suitable to be seen in clinic today? So we've seen a phenomenal increase in that enabler and that use across the community services and obviously within the community hub. So where next? Well, I mean, I think that was a really short whistle-stop tour of some significant projects. We do have to maximise the use of the integrated care record, and we need to develop Rivium further. Some bits are working really well. Some bits we need to develop more across the third sector. But as we do so, we come across things like digital codes of conduct and information governance consent. But I think I would like to end just by saying, I think, even though this is a digital festival, it would be remiss of me not to reference one of our biggest challenges in the new digital world, and that would be digital exclusion. So we see a lot, the hub in particular I've spoken about today really is supporting vulnerable people in our communities, and we really need to pick up this challenge of digital exclusion. Whilst digitisation allows us to change the way that we work to support more people than we were before, and we hope to receive more joined up care, there is a challenge around those people that can't access services in those way and in the new way. And we need to be increasingly aware of that as we head forward for transformation. So whilst the two aren't mutually exclusive, we really are challenged now to think about COVID hitting the most vulnerable people in our society, and those individuals being the least digitally enabled people in our local communities. And I suppose I wanted to end really on that thought and hope that you've been able to hear me, and thanks, Paul, for letting me run through that.
Jonah, thank you very much. That's a huge amount there, and we'll come back to your presentation, and there are a couple of questions we've had in as well, so I'll present those back to you once we've heard from the others. So Janine, could I ask you to give your update, please?
Yeah, absolutely. Thanks, Paul. And thanks, Joe. That was really interesting. And I hope that some of what I'm about to say links a bit. I'm looking at it from a different perspective, but I think there are kind of overlaps. And Joe's given a brilliant example there about how sharing data between organisations in the third sector on individuals can really help to provide joined up care and make us more user-centred as health and social care providers. And what we're looking at the moment at the Carers Centre is actually more, how do we use insights or collective data around the groups of people that we work with in order to improve the decision making that we're undertaking and the service design and delivery that we have. And this is a bit of a change for us. Might seem a bit odd, why aren't you using data anyway? But essentially what happened sort of last year was that our chief exec really recognised a challenge that we face at the Carer Centre in supporting unpaid carers, in that the number of unpaid carers is significantly rising. So between the moment, there are at a kind of minimum figure, there are about 20,000 carers in BAMES, and that figure is taken from the 2011 census, so will have increased. And Carers UK anticipate or kind of estimate through their work that the number of carers will increase by at least 60% by 2030. And we know that there was a significant increase in the number of carers through COVID. And that's obviously something that Carers UK couldn't have predicted when they were doing their research back at the tail end of 2019. So a significant number of carers against a backdrop of increasingly stretched health and social care. The Carers Centre can't respond to that and support more and more people simply by exponentially growing and doing things in the way that we've always done them. So the response to that is, well, then we need to look at doing things in a new and different way. And as part of that, we started to realise that a lot of what we've done in the past has been based on assumptions or kind of gut instinct, alongside data, but built quite a lot on assumptions. And I think we use assumptions quite a lot kind of generally in our lives. But we recognised that maybe we needed to start to be more data informed in really understanding who we're working with and what their needs are, because needs change so quickly, particularly in the internet era. And we also, within our organisation, maybe had a lack of understanding of the importance of data and the role that it could play in helping us to be better at who we supported and how we supported them. I think that's kind of links to a number of other people I've talked to in the third sector that feel they have the same issues. And I think sometimes there's so much data in the third sector, we hold so much data about the users that we support, that insights are lost, because it's almost like we can't see the wood for the trees. Is that the right saying? And if you kind of compare us to kind of private sector, I think we are being left behind in the way that we're using data in order to make sure we're the best that we can be. And if we don't start to try and catch up, we're going to be left even further behind. And when I say data, I don't just mean 1 + 2 = 3. It's not just about kind of like those kind of facts and figures. Data is about anything that your users or your user group might tell you about how they're feeling. That's data. That's data on who they are, about their behaviours, about their needs. So we were fortunate enough, having identified all of those challenges, that we gained money from the National Lottery for a 3-year project to transform us into more of a user-centred and data-informed organisation. And it's really interesting to hear Jo talk, because I think that's also some of the transformation that's happening through that joined up working with Virgin and all of the organisations that they're working with. They're looking to kind of wrap their care around the user and be user-centred. And we're looking at gaining insights from a group of users in order to change and redesign the services that we're doing to push them back out to make sure they're user-centred and meet the needs of our carers. So our key issues for us in terms of delivering this transformation project so far, we've only been doing it for 6 months, I should say that, is that we're really trying to understand what data means to us as an organisation and what data we need in order to make collective decisions about the services that we're providing to carers. We really felt we needed to improve our staff culture about changing the way that we work. As Jo said, COVID has meant that bringing digital tools in is now central to our approach in terms of supporting people. But we also recognise that being user-centred and be data-informed was really a change to culture in terms of kind of the way that we approach our work and the way that we approach designing services. We also recognise we need to improve the systems that we're using. Jo gave a brilliant example about how that's a fantastic system that enables you to use data more effectively through the Rivian product. And we also need to use all of that to improve the decisions and the services that we're offering to carers. So those are all the things that we're trying to do, but we're 6 months in, so we certainly haven't done them all yet. So just to give you a flavour, I wanted to talk a little bit about the COVID wellbeing calls that we've been delivering throughout COVID to carers. So our face-to-face services obviously kind of stopped immediately kind of at the end of March. And at that point, we really recognised that carers were in a kind of often quite a desperate situation where maybe professional carers were being pulled out of their homes. They were having to take on more care. They were potentially vulnerable themselves, certainly living often with people who were very vulnerable, probably shielding. And this was a time where they needed reassurance. Where were they going to get that from? So we developed a kind of outbound wellbeing call service where we were calling carers. But what we then recognised was we were calling hundreds of carers a week and having brilliant conversations. And all of those conversations collected together could give us a real understanding of how carers in Baines were feeling and what their needs were and what their behaviours were during this really stressful time. And this system that we were using for managing that data didn't really enable us to see those insights very clearly. So quite quickly what we did was we piloted just a very kind of GDPR compliant form that our staff could fill in while they were having those conversations. And that form was great because it gave staff a little bit of a script about some of the things they might want to ask those carers. But it also meant that data was all stored in a way that we could really easily analyse and pull out the insights. And it was incredible because it gave us such massive insight that we wouldn't have had before. And very quickly, we recognised that we'd made assumptions. And we'd made an assumption that the carers who were most in need were 70-year-old, carers in the 70-plus age range who were identified at the start of COVID as a very vulnerable group of people, most vulnerable to COVID, most likely to feel alone, most likely not to access digital tools. They were the people we needed to prioritise. Our data didn't tell us that. Our data showed us that the carers who suffered the most during COVID, bar none, were young carers, because they stopped having school as a break from their caring role. They were suddenly facing 24/7 caring situations, some of them really tough. And if you may think that younger people have, digital access and are more savvy, digital natives in order to use those tools. But if you're at primary school, you're not on Facebook, you're certainly not on WhatsApp, you don't have the ability to connect with your friends at a younger age. And those young carers really suffered. Whereas the older young carers, yes, of course, they did also have the older carers had difficult situations. But it was interesting how then using the data had flipped our assumptions on its head and really showed us the importance of this journey that we're on in order to put data at the centre of our decision making and use it to influence the services that we're delivering. What we also did, which was really successful, was kind of start small and start pilot new ways of kind of using and kind of implementing more data-informed and user-centred approaches. Really quick example was, which is non-digital, which kind of speaks to what Joe was talking about in terms of remembering that not everyone is digitally included. There are a lot who are digitally excluded. So actually one of our big pieces of work was about how can we deliver breaks for carers, give them time out from their caring role at a time when they can't leave their houses and a lot of them can't get online. And we actually use some new digital approaches using, I'm going to use some words now which might mean nothing to people, and I'm really sorry about that. But we did some assumptions mapping. What are the assumptions that we're making about carers? We did some consequence scanning, which is another tool which is often used within the digital world to think about what are the consequences that some of the prototypes or tools that we were developing could deliver. And through all of that, we came up with a pilot idea, got some insights and feedback from carers as to whether the idea was a good idea. And that was about offering free time breaks, where we sent breaks out to carers, small craft kits, puzzle kits, books they could read. And we set up a program where they were sent these breaks. That was then followed up with a phone call to make sure they'd taken the break. I hope that doesn't seem a bit like a stick, but because often carers don't, because they concentrate so much on the health of other people, not their own. And that project started small, bit of a pilot, got some feedback, improved it, sent it out further, got some feedback, improved it, offered it to our entire carer base. And through 6 months, we've been able to support almost as many people through that break programme as we would have done in an entire year pre-COVID. So by using that more data-informed approach and by using other kind of user-centred approaches to service design, we've really managed to revolutionise the way that we offer carer breaks, and we're starting to look at how we can use that across other services that we offer as well. So that's how we're looking to use kind of like insights and kind of big level data in order to influence our decision-making processes, which is slightly different kind of to Joe, but I hope you can see how the two connect together in terms of using data. And I think our next steps are to continue to do that, to continue to improve the tools that we're using in order to use, kind of maximise the use of data, to roll out our learning further within our staff team, because I think changing our staff culture and keeping all of our team on board is kind of really vital to this, as it is across, bringing everyone who's working in health and social care with us on this. And also working with James at 3SG to look at how we can, really share our learning about these new approaches, and also share our insights about carers with other people in the third sector, because certainly the Carer Centre is not the only organisation working with carers. And it would be great for us to be able to share those insights. Hey, we found out this about carers, or we found out this, and for other people to be able to share those kind of high level insights with us, because the more knowledge that we have, the more we can turn that into wisdom, and the more we can all deliver services which best meet the needs of people in BAMES. So I think that's where we're hoping to go next. And I hope that kind of added to everything that Joe talked about in terms of the new way we're offering integrated care across the area.
Yeah, that's tremendous, Janine. Thank you very much. I think especially, I hadn't thought about the way that you could use insights to data to then change the way that you were thinking about the people that you're dealing with. And I think I'm really interested on that, and to talk about, again with Joe, like the digital exclusion that's going on, but also some of those cultural barriers that you were talking about. So I think when we've heard from James and Lorraine, we'll have an interesting discussion on that. So thank you. So James, could I ask you to give an update, please, on 3SG?
Yeah, sure. So my organisation represents around 200 local charities and social enterprises. So a lot of the themes that have been talked about already are very relevant to our audience, because actually we have such a diverse range of organisations, but we are in general helping the same people. So what we want to get to is a point where all of the different services and organisations can actually work more in partnership to provide a better service for people that live in the area. So things that we thought might take years have been done, in weeks, in terms of what happened in kind of March and April, working with Virgin Care and the council and others. So it feels like we've moved forward greatly, but I think where we're looking now is, well, what are the kind of tech barriers? As Janine said, what assumptions have we made that we need to actually, put some meat on and actually think, well, we have all these charities, we want to work together. How do we actually do that? And, that's where it's great that we've got Rivian based in Bath that are, really engaged with the hub, because there's a possibility of some dialogue there where we can actually look at the problem and look at the whole system and all the different ways that works, rather than just coming in with a shiny platform and saying, well, this is the solution, fit your services around it. I think that the way to look at it is to have a dialogue between all of the different organisations and see how we can make it work. So, I think it's an exciting time. I think some of those barriers have gone, and I think that's an opportunity for us to try and work together and actually, move on past some of these long-standing issues.
Okay, great. Thank you. Lorraine, would you like to just talk a bit about PRSB and social care information?
Yeah, thank you very much. And that was fascinating, having those views from kind of the sharp end of care and to reflect on that in relation to our role nationally. So, as I said earlier, our core purpose as an organisation is about developing the content of information records, so information record standards. And I hoping I can take as read that people think, standardised information, structured, coded information is a good thing. It's kind of, the NHS and social care are quite a long way behind most industries in that respect. But bottom line being that if we want integrated care and to be able to share information easily and safely with the same meaning between organisations, then you've got to have standards. And that's what we do. So it's kind of the bedrock of digital, I think, is how I look at it. And the way that we go about that, the most powerful thing by far about the PRSB is our members. So, we're a community interest company. Our members sort of own the organisation, and it's if you have a look at our website, it's a very good proportion. I think pretty much all of the Royal Colleges. We're really proud of our social care credentials. So we have adults, children's, care home association, and so on. So we work hard at that. And the third leg of the stool is patient, carer, citizen representing and advocacy bodies. So basically representing the users, and we develop standards in collaboration and through consensus with all of those. So that ability to bring all of the disciplines together and agree what is the information need in different scenarios. And that's really quite powerful. And actually it's, in digital terms, it's the first time really that it's been done this way in terms of bringing the key users with us. I know people locally, I'm sure you do that really well in terms of working with your users, but nationally there's quite a bad track record of how that's been done historically. So that's really good. And some things that might be of interest to you that we've worked on this year, to pick out a few. So this year we had a major programme that started in January around standards for social care, because I think people generally accept that social care is a bit further back in terms of standard. There's a lot of free text and unstructured information. There's some way to go in health, but I think, social care is a bit further back in that loop. So we were delighted to do that. And we did a lot of work with care homes. So what's the information needed for good care, best care in care homes? We did standards for emergency admission from care homes, the local authority information set, and that kind of thing. And we were, because of COVID, I think it was quite good because it forced us to be more creative about our consultation techniques and how we engaged people to make sure we really heard what people needed. And so, for example, we did things like easy read surveys to reach people and to make what we were asking accessible. We ended up having, phone interviews and little video podcast things on people did on their mobile phones in care homes and so on to get really good coverage. We ended up having more than 1,000 responses. So that work is just finishing now, and that's powerful because those standards are now, one hopes that's ready for spread nationally so that the benefits can be achieved. Other things that we've worked on, care plans are really important, integrated person-centred care plans. I think social care are better at that generally. And one of the areas that's been really interesting in that is what we call the About Me information, which is basically, again, this is an area where I see a real shift to the person being in control. The About Me is about what does the person want? What are their goals? What's the information that they want people caring for them to know about them? So it could be religious tendencies. It could be that they've got cats at home and they won't relax and get better if somebody hasn't sorted out who looks after their cats, etc. And what's been really fascinating about that is how powerful that is. It's not just, oh, that's kind of interesting as well. It's seen as important, probably more important than the clinical information that we traditionally focus on. The other one that's relevant to some of the things Joe was saying and so on is we developed something in 2019 called the Core Information Standard, which is basically the blueprint, as the name suggests, for the integrated care record, the person-centred shared care record. So that's really important. I don't know if the one Joe talked about is in line with it, but let's hope so. That might be a follow-up conversation. And then at a more granular level, the kind of things we're getting involved in just lately are things like coding for COVID. So, all of the vast amount of information that's captured in health and care, what is it that we need to know that's unique and specific to COVID that isn't currently coded for? Whether that's the diagnosis of COVID or the different stages of COVID or whether somebody's shielded, that kind of thing. So we did that earlier in the year, and it's great because we've already seen the results of that flowing back in, that people are using those new codes. So we're capturing powerful information about COVID that will help us care for it better and also to inform research and so on for the future. And just in the last week or two, we've started, topic of the month, long COVID, to think, well, what does that mean and what's the information that we need to capture? So that's just a flavour of some of the things that I think are relevant to what you're talking about, Paul.
Yeah, I think that's really interesting. So I think your work nationally, where you're defining standards for their national adoption, and then what we have here is a group of people, obviously in a local area, who are maybe coming at that from a different angle. Yes. And I think actually a number of things that James will be getting involved in, kind of coordinations of groups to understand how they can work together. That'd be quite interesting. We've unfortunately just lost Sian, who is involved in that integrated care record with Joe locally. And actually, if I can go to a couple of the questions now we've had from people who have been very patiently waiting for us. Joe, one here question for you that's coming in is just asking a question from Stephanie Newman about whether or not the ICR is restricted to residents of Baines only, as people who live outside the area use, facilities like the RUH, for example.
Yeah, so I think Sian answered that one, but I just before he left. But to answer it quickly, the answer is at the moment it's restricted to Baines. It is going out across Swindon and Wiltshire, and there is a very confusing project across the top of them that integrates all of the integrated care records. So the answer is if you currently attend, say, the BRI in Bristol, that won't be on this record, but there are projects going on to join those up, and you will eventually. So this is the start, but there are plans to join up all of those dots. I think it will take however long we think it will take about 4 times as long.
I agree.
Okay, very good. A question, Janine, for you that's come in is around the way in which we talked about how does the use of data for your staff, or what does it mean for your staff in terms of the insights of the data that you've collected. I guess I'm also in and how they had to adapt to that data and what it's telling them.
So what does it mean for our staff? I guess it means a number of things, but it means they might need some new kind of skills in terms of learning to kind of read data and understand data, because I think that is a bit of a skill. I think it's a skill that you can learn, but it's a new skill. So I think that's something that we're sort of working on at the moment. But I think the main benefit from our staff actually is that it gives them a lot more confidence in what we're doing, because you can see the benefit and you're doing things which are meeting your user needs. So I think actually that's one of the reasons that because I don't deliver a lot of these services directly, I'm kind of helping people to deliver them. But what's brilliant is that although I'm leading and I'm driving the digital transformation, it's actually being delivered by people kind of on the ground, and they're really kind of engaging with this new way of working and this new way of thinking. And I believe that's because all the way through, we've drilled home the message and we've shown examples, and we've given, we've brought back the insight so that people can understand what the data means and how they can take that forward. And I think actually they have really lapped that up, because all of a sudden it's like, well, I don't have to worry if this is working because I know it's working. I don't have to worry if I'm meeting the needs of the right people, because I know I'm meeting the needs of the right people. And it's actually, yes, I think sometimes people are worried about data because it can feel like quite dry and quite boring. But when you understand what data is and what it can mean, it just opens up a whole number of doors. And I had a conversation, I've been doing a pilot with one of my colleagues, Sarah, and we kind of at the end of the pilot, kind of talking, just kind of reflecting on what we'd learned. And Sarah said, at the start of the pilot, I was like a little bit worried that it was just going to be really boring. And I'm so glad I've done this, because I really feel like it's making a difference to the way that I'm working.
Yeah, because I think that's really good, because I think we focus a lot about, and quite rightly, about how we're trying to put information together to improve outcomes for people. And I think one of the things that we often miss completely is what the information can do for people who are actually delivering the care, and and what we can take from that. So I think that is, and obviously, say I guess your system there of data collection is going to rely on a lot of feedback from carers. Is there a certain aspect of kind of feeding the kind of machine so you can get the insights?
Yeah, absolutely. And I think we use Microsoft Teams kind of internally, but what we've got within that Microsoft Teams is a good news channel. So whenever someone hears something which they really want to celebrate and they want the organisation to celebrate, they put that insight, and an insight can be a sentence from a carer, that's an insight. They put that into the good news channel. And it buoys everyone up to hear brilliant news about how a carer really values the work that you do as an organisation. That's what makes me get up in the morning and come to this job. So it's brilliant to have that. And the more we've added to that channel, the more it's helped, and the more it helps morale. It's just a fantastic way to kind of move our organisation forward.
That's really good. I'd like to just ask the panel a question around. We talked a bit, Joe, you talked about this, and James as well, as about how the COVID kind of crisis has driven change. And I'm interested about how why we think that has made this kind of health, say for example in Baines, the health, adult health, the council and the third sector, how has that helped get over what I presume are maybe some cultural barriers of working together?
Do you want me to start and then James come in? Yeah. I think it's helped because suddenly people are not able to rely on going down the corridor and asking somebody for a piece of paper, or looking at or speaking to the person in front of them, but they are obviously working from home and needing to access those services. So I certainly think there's a need, and that is opening people's eyes to what is then available to them. I think just to be quick, I think that the digital literacy is still a massive issue. It's critical for us, and it's been really still very challenging. So again, we talk about digital and digitalization and those who are excluded, and some of our own colleagues actually excluded, and we are investing a lot more now in training for those colleagues. But whereas before they could choose to ignore it, I don't think people can choose to ignore it, and that's really helped with the culture. But I'm going to hand over to James.
Yeah, I think what's helped is that colleagues in healthcare have got a really a clear understanding of what the third sector can do and how flexible we can be. And I think that's been really demonstrated right across the board over the last few months. And it, ironically, actually being sort of physically located together in a building has had a huge impact. You know, when everyone else is kind of suddenly working virtually, we've actually been working here since March in the hub. And those kind of barriers where you've got, you know, big organizations working in silos have definitely been diminished just by literally sitting next to each other and being able to talk about things in a more kind of personable way rather than just through email or, you know, in kind of large impersonal events. So I think that's been really key, is establishing those personal relationships, but having a kind of shared technology platform that we can put it into practice. Because without that, it would just be a series of conversations.
Yeah, agreed. And Joe, I mean, on that point that James was talking about, the aspect of being able to coordinate care around somebody's needs, can we talk a bit about that in terms of how you think maybe moving forwards as well, you know, digital can help?
Yeah, I think absolutely, Paul. So I think before it was a bit like you said at the beginning, people would have to have called us and we would have given them the number for the carer centre, and then they would have called the carer centre, who then might have advised that they speak to Age UK for the hot meals. And actually, because everybody's in, you know, there are MDTs now that take place, but because people are assured that you can share that information securely and appropriately, people are starting to think more about wrapping care around those individuals. So I think that's been a really key benefit, and has prevented some people from, you know, needing things like hospital admissions as well. When next, I think, is really interesting, Paul, because, and to a certain extent, we've got 14 organisations on. That is manageable in terms of information sharing agreements, making sure everyone's got their information governance standards, starters and leavers, and the codes of conduct. We desperately want to go out across more third sector organisations and indeed non-third sector organisations, as is appropriate, to share referral, to continue to wrap care around people. However, you know, as you get wider, the challenge around, well, actually, I consented for my information to be shared appropriately, but now it's being, you know, handed on to a third or fourth line, plus, you know, that code of conduct, the record keeping as people start and leave. I think that's a real challenge for us. I think it's one we've got to face and we're facing into, but in every benefit of widening it out is going to come sort of challenge as well.
Yes, we've actually had a really good question on that point about, really, it's about how service users can be included. And the question that's been posed talks about, there's a lot of things in the question actually, but talks about how, you know, carers and people providing services are provided with different information and often using emails, and they've got different systems that they're using. And really their question is asking how, you know, can we be encouraged to look at digital inclusion, to consider ways of using digital technologies to allow users to kind of cooperate with their carers and carers to be able to share information between each other. I think it's an interesting point, because it's something that we're working on as part of our services, which will be coming into Baines, about allowing different third sector organisations to work more together around somebody. I think this point's also saying, well, how do we allow the individual and the carers too to have access to that information and be part of that? And that's quite a big topic, but it's quite a good one. I think
it's a really important point, but it is a big topic, and I think it could be answered, Paul, a number of ways. There's obviously the access to people's information, sort of person-held record and portal. That's a conversation across Baines, Swindon and Wiltshire that's being looked at. But I also think there's something here around you know, remote technology as well, and Shan would say that if he were here, you know, technology in people's homes that they are looking at self-management, self-monitoring, and are able to put into their record, as well as possibly, you know, 5 or 6 dozen other systems. But certainly I think we've got a real gap in Baines, and where we can look to next around how are people supported to self-manage and then report that into their supporting systems. I think that's a big opportunity for us in Baines.
Yeah, Lorraine, sorry, yeah.
Yeah, can I just add to that? Because, you know, one of the most powerful things about the way we work is by involving people. So when I was talking about the About Me information earlier, we had the mother of a boy with profound disabilities, and just her impact and being able to say what was important to her was profound and fundamentally changed the end result of the standard that we came up with. And for me, you know, thinking about COVID and what happened and the big changes, we've just done a big exercise with all of our members to reflect on what we learned and kind of, so what then, what do we need to do differently? One of the strongest ones was about people, empowering people and their role in care. It's enormous, you know, and what people showed us in a COVID context is not only can they engage with digital, they're positively demanding it now. So I think the biggest lesson for kind of all of us in different kind of roles is to kind of completely shift our mindset, not seeing that as an add-on, but that is the main game going forward.
Yeah, I think that's right. I think a lot of the barriers to that now are actually rooted in the organisations who are providing the care, because A, they don't have it themselves, and B, the people providing that are reticent to do it.
And professionals who have been brought up and trained to be in control, you know, and something like virtual consultations, in my view, completely shifts the power balance. You know, you don't have to go at the consultant's convenience and so on. It's kind of in your own home. We've had feedback that people with disabilities, it's so much easier for them. You can have 3-way consultations and bring in the GP at the same time and so on. It's just that mindset shift. So I think the more people can think about that, reflect on it, and go with it, not slip back to where we were before, would be a really positive thing.
Yeah, no, I agree. I think that's a really good question. And I think the challenges, I know from some stuff from the King's Fund that we saw a year or so ago, is that it's looked at in the sense of, well, how can you prove the benefits of that to the system, rather than actually that will come. I think it's like, what are the benefits it gives to the person who's receiving the care or their support network. And I think it's completely lost. I have another question from one of from Stephanie again, who's coming up with some brilliant questions. How have you found integrating different IT platforms into one system? I can say it's a nightmare. I think just to me, what Lorraine's doing from a national level is about information standards, and it then drives technical standards. We just answer from us. I mean, we integrate with GP systems, with community systems. We've got all sorts of different interfaces, and it is a constant challenge. And I think it will be for years, because you're dealing with different maturity levels, different cultures, where a lot of system suppliers and organisations still go with information is power, so they don't want to allow integration. And then you've got the other aspect of actually there's so many different things to integrate with. Where do you go? So for me, I think it's we've always had the culture of doing it, and with NHS systems, but it is a big challenge. Anybody else like to respond to that?
It depends if we're allowed to use rude words, doesn't it, Lorraine?
Yeah, absolutely.
Really hard. I'm going to hand over to you.
It is really hard, and we completely know that. I'm, you know, and I wish I were in control of all of that chain of things that need to happen that would make it easier. I do see positive signs, really positive signs in the centre, actually, that mean that penny is dropping. So I'm hopeful about that. But one of the things I always say about standards is, you know, if we had a blank page and we were starting this, it would be easy. We're not. There's all the messiness of existing systems and so on. And for me, a standard is good if you think of it as, you know, that's where we're aiming for. That's what's really, you know, that's what good really looks like. We all have the same vision of where we're trying to get to. But the path towards it needs to be pragmatic. It needs to build on things. It needs to do things tactically and join it up in ways that might not be technically perfect, but it will do, and it keeps moving us forward. So I think we have to be practical and realistic about that. Yeah,
I agree. I think some of the best things that we've got that operate are kind of practical things
Yeah.
that have not been born through massive
whizzy technology.
Yeah, exactly. Yeah. That's really good. Now, I'm conscious we're at 2 minutes past 3, so we're a few minutes over, but I've got a couple of more questions. One more to the wider panel is about information governance. I mean, historically, whenever we've tried to do kind of working together care coordination projects, we get lots of objections from people in organisations. I think COVID's shown us in a more accelerated way that actually we have to work. Obviously, we need to have the information governance, the security there. But actually, is IG used as a barrier, not as a risk aversion method? What do people think?
Sorry. Every single consultation we do, it comes up, and it's a slightly frustrating one because we're not in charge of it. But it does. It's obvious that that's a huge thing that people focus on or they want to understand. And I do think it has historically been a real black art, and that people get involved in information governance who are really amazing experts in information governance. But, a 200-page document on what to follow isn't helpful for anyone. But I do see helpful signs. I think there's a IG portal being, I don't know if it's there yet, but to be there soon, isn't there? Nationally is being provided. So that would be one of the things that I think people are getting it now, that this has to be massively made simple if you want people to respond quickly.
Yeah. We've... Sorry, James, go ahead. Yeah,
I was just going to say, I think it can be perceived as a barrier, especially for smaller groups that are, very, very much like a one person operation. But that's where I think something like 3SG or the support of a wider network can actually break down what those challenges might be and say, well, look, here's a template, here's some advice, this is how we did it. And we just take people through it with a bit of hand-holding. And, 3SG, we've been on that journey. We didn't have some of these policies before February necessarily, had to come up with them pretty quick once we had 2,000 volunteers come on board. But it's the case of sharing that information, I think, is key.
Yeah, I think that is true. And I think for me, it's always a balance. And actually, we've had an anonymous question again, actually, that relates to this, where somebody's had a family member who hired somebody to help them with their direct payments, and they had like a digital to-do list and they had a care plan and things about them, but actually getting access to that was difficult. It was password protected. There's all sorts of different things. So I guess there is, and that's a good example where actually you've got somebody here obviously asking these questions who's very capable, very literate, very technology able, wanting to be sharing information with their carers and their support network. Yet there's the barriers of practically doing that. And I think we've seen that as well. There's some very good ways of using some tools to kind of share information quickly, but actually organisationally, when you get into the bigger health organisations, then the IG stops that because of the potential risks with that. What's people's views on how that could become better?
I think just it can become better, Paul, but I also don't know if we've got exactly the right systems to enable that yet. So what I found the biggest difference was in COVID, particularly information governance teams started saying, how can we do this, rather than why should we be doing this? So I think there's a massive change.
Yeah.
And they're just those small words representing a phenomenal shift. So I think we've come a long way. I'm not sure that the systems there around sharing data appropriately actually we're technologically there yet. I think there are a couple on the market, but I think that we've still got some way to go before we get there. I think they're absolutely right to raise it. I think it is a good point. There are some good monitoring systems that you can now share, but a lot of the systems we've currently got, and bearing in mind how we've just said how difficult it is to technically integrate, I think a lot of the systems we're not quite there in its capability yet, let alone them rolling it out. And that's not to be pessimistic or say we shouldn't or can't do it, but we're just a bit of a way off having a really sort of neat solution to do that yet, I would say. Yeah,
no, I'd agree. Okay, I'm very conscious that we are over our time. Does anybody have anything they'd like to say before we finish? Okay, I'd just like to thank everybody, our attendees as well, with some really good questions. I think actually it's been a brilliant illustration of the innovation and drive that's happening both locally. We've heard some really good examples of that in Baines with Janine, James and Joe, and also Lorraine with what you're doing nationally. And I think that this next kind of five years is going to really see a massive change in the way digital technology is used, and is also driven by the bigger issues of funding, etc., that are driving the changes from the NHS perspective. On that point, I'd just like to end there. I'd like to thank the Bath Digital Festival for enabling us all to meet today and providing the platform for us to do this. It's a great festival. This year it's all happening virtually, and I guess it may go next year, but we've certainly found the festival to be superb each year that we've been involved with it. So I'd like to thank again the Bath Digital Festival, and thank you all for coming today. Thank you.